Okay, so good afternoon, everyone. So this is our pleasure to provide you with this, I would say, information session on what was in the back of our efforts, our recent efforts, going from Prismap to Prismap Plus. Kirsten, if you want to give us the next slide. So we have been able in the present Prismap program to provide biomedical researchers in Europe and even beyond with their infrastructures and services so that research with what we would call non-conventional radionuclides has been enabled and promoted throughout Europe. And actually, this effort or this need, which has been recognized now to a rather large, I would say, scope of institutions is even more highlighted and has been, if you want, highlighted in as a European need, and this is more specifically embedded in a long-term strategic vision that the European Commission is setting up from the past few years into probably the next 10 to 15 years. And this is more specifically defined as the European Radioisotope Valley Initiative. And this was recognized even higher up from the Council of the European Union, which is a high-level governmental European institution. And if we want to actually reflect, of course, on what has been ongoing in Europe with respect to what is ongoing in other parts of the world for nuclear medicine, we will immediately or very rapidly, of course, see what's ongoing in the USA, and we are aware that we have this national isotope program, which is ongoing and has been ongoing for, I would say, probably 15 years now, and which as well is a quite recognized and very successful program in North America. But looking at actually the recent developments, which is in there, we can see with great interest that the US is even more supporting, are going to support more at the government and federal level their isotope research program, and this is shown, for instance, on the table here that you could access to. So back to us. So we have been transiting then or taking Prismap to the next stage. Prismap was approved until 2025, and we have been answering what or a call from the European Commission, which is addressing these needs indeed of reinforcing the research infrastructures for the main challenges and EU priorities. So if you want to go to the next slide, Kirsten. So even if US has been very active in developing their national isotope development center or national isotope program, when we started Prismap after a few years, we were quite surprised that with what we believe was a modest contribution in this trying to answer some needs that were identified in Europe, that actually it was echoed very favorably from researchers in the field in the US, and this was recognized when we participated at the last Frontier Research, Gordon Research series on diagnostic radiopharmaceuticals. And we were surprised to see that actually the access for reperforming research with innovative or non-conventional radionuclides was not so easy in North America. And whereas Prismap was indeed with the portfolio that you see now on the screen, was already allowing to enlarge and enable a much wider range of research and prospective project combining diagnostic approaches, right? Combining diagnostics and treatment radionuclides and therefore radiopharmaceuticals, which is the very large success that nuclear medicine is now undergoing with the new treatment radiopharmaceuticals that we see are ongoing and coming up on the portfolio or palette that nuclear medical doctors and doctors in more general could propose then for treatments of very difficult cases. So if we go to the next slide, yes. So Prismap has been ongoing for the past 4 years or 5 years. Will be then transiting into the new program, of course, provided we are select funding Prismap Plus. And the main efforts, which was in the back of Prismap, was to set up the supply chain that we see here, which is then regrouping major infrastructures, most of the time research infrastructures, which have unique capacities in this production capacity of either diagnostics or therapeutic new type of radionuclides, but as well with a full supply chain across Europe so that you could combine in different sites in Europe from irradiation to purification and dispatch, and even to the point that we offered in selected biomedical research hubs the possibility for researchers to be hosted in the biomedical hubs if, for instance, the groups were not having a license to handle or to operate with a radio pharmaceutical. And this capacity then was recognized throughout Prismap with a successful implementation of more than 40 projects that I will very briefly touch upon later on. But you see as well what was in the back of Prismap was the access of this research radionuclide through a selection process, which was ongoing very smoothly, and as well to a creation, if you want, of standardization and new nuclear data and interaction with the licensing authorities, so that the research with this not so classical radionuclides could be promoted across Prismap and Europe. So next slide, please. So you see here exactly this process of how Prismap has been implementing something which has actually found nowhere else before our program, which was the provision for free of these radionuclides, of course, provided the users could afford the shipment for deliveries of the different batches. And that was done through regular calls for projects and applications with a user selection panel, which was actually chaired by our colleagues from North America, not US, but from Canada, from Triumph, Cornelia Herr. And you see here it was a mix of representatives from the Prismap consortium and external experts with renown and very strong insight and expertise in different fields, of course, related to the developments of theranostics compounds. And you see 5 calls of project which happen in Prismap, and you see the induction phase, I would call that, until the third call, where we had not, I mean, significant, but still moderate number of applications and selections to use projects to finally, or let's say, to a second phase with a step subscriptions of Prismap services and selection of projects, where we went from 5 to 10 projects selected to 15, 16 projects selected from a larger number. And you see as well that the European scope enlarged. And that was for us the sign that we had matured and had understood how groups with good projects could actually apply to Prismap services, and that was through maturing or coaching, if you want, as well, the users which had good projects so that they could benefit the best from the Prismap radionuclides. It was not directly linked, but as well along the development of Prismap, we were proposing new type of radionuclides. Not so many, because we were not fully equipped to do that, but there were still a few more radionuclides which were being proposed, for instance, for call 4 or call 5. So next slide, please. So at Prismap, so we are finishing end of this year. We don't have more open calls, and this will need to wait for Prismap Plus, that we hope is submitted at we speak, is going to be evaluated, and for which we wait for feedback of evaluation foreseen for beginning of next year, and which then would allow Prismap Plus to take on from the present Prismap status. That means sometimes next year. You see here that we have been able to provide about 50 projects across Europe, and we have as well been able to see how the access to our services and how the selection, how to access to this common platform was perceived from our the groups which were benefiting from the Prismap services, either nuclides or hosted in the biomedical hubs. And you see here, I just extracted a few codes. So they were not all absolutely positive and without any, of course, comments that we took or are going to take into account. But you see here that there was definitely a recognition of the selection process, which was recognized as being smooth, efficient, and rather transparent. The service in exchange, once the project was selected, which was whether positive. Sometimes there was some issues, but that could be addressed, and issues could be that either there was a delay, there was a deviation from the specification requested at the beginning, or there was a need eventually to have extra services, which we would be able to implement if, of course, the project was advanced early enough in the course of Prismap. And as well, there's recognition for some of the services that the quality, and that can be, of course, the access to radionuclides, which eventually would not be possible otherwise. And we had the recent Congress of the European Association of Nuclear Medicine in Barcelona, and we could see after only 4 years that some of the projects granted in Prismap was taking their way to the scientific programs of the ENM Congress and to this category, which is selected for, I would say, the best results. This top-rated representation, and 3 of the Prisma project, the last Congress, would integrate this track in diagnostics or radiopharmaceutical, and you see the scope then of Prisma project, which was contributing to the scientific excellence of ENM activities in either combination therapy or innovation in translational oncology, or finally even in the production of the radionuclides themselves. And that was, in that case, coming from the Prismap institutes, which were providing a new type of radionuclides. If you go to the next slide, please, Kirsten. So the initial aim of Prismap was to be able to provide clinical translations. I mean, not only to stay at the stages of preclinical research. And we have been able to witness 3 projects which translated their activities, their good results at the preclinical stage towards the clinics in quite different settings. So we see as well that it was very different radionuclides which were translated to the clinical stage. And we see as well with these 3 projects, they were reaching the clinical stage in very different modalities that we did not anticipate at the beginning. So one was traditionally then after a preclinical stage was to file authorization with an IMPD dossier to be able to enter into an early phase clinical stage. They have not entered it, but they are at the door, I would say, with terbium-161. A second one was an interesting combination of imaging and diagnostics alpha emitters based on lead, and that's from a hospital in Germany. And in that case, they were entering into a compassionate care type of modality with the diagnostic isotope. And the last one is an interesting in vivo model, which is going to enter into in clinical phase from the French group of Professor Morga, in that case, the clinical translation is taking place with the support or with the recommendation, let's say, of Prismap, but outside fully of the scope of Prismap. So if we go to the next stage or slide. So this gives me I would say the possibility to introduce you with Prisma Plus, which was just submitted a few weeks ago to this targeted call, and you will find in Prisma Plus some important elements that we are or have been able to take into account, of course, addressing the request from the Commission in this targeted call. And you will see with the slide here that we have been able to still or even reinforce the inclusion of what we call future or emerging infrastructures, which is an important part or has been an important part of Prismap, and we're still seen as an important part for Prismap Plus, where we are from the onset and from the, I would say, induction of the project in this in our large-scale facilities, we are able to integrate the emerging infrastructures in our network and consortium, or at least propose to do so for Prisma Plus. And this will allow Europe to benefit from either a new infrastructure which is based on isotope mass separation and leading accelerator centers, and or of neutron facilities, which we see from Europe is emerging as a leading European or world center, I would say, with very interesting characteristics, and notably for fast neutron irradiation. So I will not enter into the details. I will just briefly mention, of course, the radionuclides that we plan to offer, but there is in Europe leading centers which will have unique capacity for this field of innovative radionuclides. And you may recognize in this chart that the geographical scope as well is much enlarged, is reaching out north, south, east, and west. And without entering into details, we believe this is probably some of the possibility to have a success for sustainable and reinforcing the reach of Prisma. Uh, what we, of course, or what as well you may notice is that now we are as well partnering or propose to really have the stable isotope enrichment not as a offer of services, but as a mean to reach interesting rates for European researchers for these medical radionuclides. So if we go to the next slide. So you see here that now with this chart, it's the same as the one before, but now with the radionuclides that you recognize, we have a similar chart in Prismap. This is, of course, Prismap Plus has its, I would say, roots. But you will see that there is a bit or a larger extension of radionuclides, and I will not detail to you the 8 more radionuclides which are foreseen for Prisma Plus. This, of course, will be under evaluation and for feedback. But to tell that this is now extending towards new modalities for either diagnostics or therapies, and in particular considering either in vivo or classical generators, and as well new type of chemical properties, which can be very important to use as traces or to combine nuclear medicine modalities with other modalities of biomedical research, biological research, or oncological research. So if we go to the next slide, which is actually the last one and meant as an introduction for the forthcoming discussion that I hope I invite you to trigger. So we will keep the Prisma platform open while we are waiting for the outcomes of Prisma Plus and to set up the new project should it be, of course, evaluated favorably. And this is through either the Prismap website and through the help desk, or this medical radionuclides.eu platform that we wanted to sustain and established on the long term. So we hope with this Prisma Plus that first we are raising your interest, that you will be able to benefit from the services should it be, of course, selected. And I remind you that we have a final conference for Prismap. This is in 1 month, This is in Warsaw, hosted by our colleagues from NCBG and Polatom Institute. And this is where you will be able to find out more on what have been the latest results and learnings from Prismap and how we project ourselves in Prismap Plus. So thanks for your attention, and happy to now start our questions and answers.
There is Nicolas from Rennes.
So thanks for the presentation. Do you have an idea when you will have the answer for Prismap Plus?
Yes, there is the information is public and be found on the European website. So the evaluation will be available by February 2026.
Thanks.
There is a question in the chat. I see that the session is being registered. Can we get a copy of it? It's from Pedro from GRC Karlsruhe.
Yes, we will make the recording available on the public event page, where you also found the invitation for today on the same page.
Dr. Meyer.
Yes, hello. Thank you very much for your kind presentation and also for providing us with this radionuclides. This was really tremendous for us to progress in our research. I have a question related to the new consortium, or I mean partners. So far, we collaborated with CHUV, so the medical hospital in Lausanne, and I noticed that this hospital is no longer partner or a laboratory where we can get access to the radionuclides. So will this be still possible to collaborate with these people at CHUV, with David Viertel, for example, in the new format?
So as you know, so we are in this transition period where Prismap is still ongoing, and you have been indeed, if I'm not mistaken, been able to receive and provide and have indeed collaboration of services with the CHUV node. So we had restructured a little the foreseen biomedical nodes in Prisma Plus. So I probably should not communicate too much until we are evaluated, because first there will be a selection, then there will be a negotiation of the consortium and grant agreement that is happening early next year. This is indeed foreseen that Lausanne Hospital will probably offer different ways of contribution in Prisma Plus. But I want to reassure you that there is indeed capacity of Prisma Plus to address or to probably answer new projects that you may have. If you really have ideas and wishes specifically for CHUV in between the start of Prisma Plus and the end of Prismap, which will be certainly probably a gap of 6 months, of course, you are welcome to see how you should develop any project collaborations further in between, yes.
Thank you for the answer.
Yeah, maybe to underline that during this transition phase, the best is to contact us through the help desk, which is available on the Prismap website, just as during the application phases for our calls.
Is there any more questions? I don't see any raised hands now. Nicola, is it a second question or it's
it's a second question.
Please go ahead.
I was looking in more details to the isotopes that will be proposed in Prisma Plus, and some of them have disappeared. So for some projects that have been started but not yet finished, will it be possible to have them in some other way, or will the production be determined?
Very important and very interesting input. Thank you for the question. So indeed, so you have the platform, the interface, which is remaining in place through the help desk. And this is the way we have been able to offer new radionuclides, or eventually that could be the way to keep radionuclides should, of course, the interested researchers need to get for some project. Of course, what will be offered in Prismap Plus will be addressing the needs and being served if, of course, the consortium can do so, and if the project are selected for service access. So, but meanwhile, indeed, please react through the help desk, and that's a very good comment. What I have shown is what we are calling so-called day one services, and this may, of course, be evolving should inputs or feedbacks being received from what we call the user community or user forum. Yes.
Is there any more questions?
Dr. Meyer has still raised the hand.
Yeah, he's
Not sure
taking
if that's
from-
still actual.
Oh, that's fine. I just forgot to
Thank you.
uncheck.
Okay.
So don't be shy. This is really for us the way to indeed, I think, address even, and we had very important questions so far, which I'm sure was useful for many different people. I mean, here again, I mean, if you, I mean, in terms of interactions, you're very welcome to get to us to Prismap through our interface, which has been very active, I would say, this help desk interface, or this contact interface in Prismap, where we were addressing very different type of requests, even on industry access, or why why my favorite isotope is not there, or okay, how should I orient this or that activity. So you're very welcome to continue interacting with us this way, and even for future questions you may need or you may have.
There don't seem to be more questions, at least for now. I think then, Thierry, we can close this session. But of course, you're always welcome to get in touch through the help desk or the contact form as well. And we will soon make also this recording available so that you can have a look at that once more if you want.
Okay.
Thank you very much, everybody.
Thank you.
See
Thank
you.
you.
in Prismap.
Thank you.
Cool.
Bye.
Thank
Bye.
you.
Mm.
Bye bye. Bye bye.